Vijayalakshmi Nanda ma'am, IQAC Coordinator, Dr. Nisha Vashisht ma'am, Staff Advisor, Dr. Yasha Yadav ma'am, other faculty members of the department, and all the participants present here. I, Chaitanya Sunil Bharadwaj, the General Secretary of SYNAPSE, the Zoology Society of Miranda House, take the privilege to welcome you on behalf of the entire Zoology Department to the webinar on No Dementia, No Alzheimer. Let me introduce to you our guest speaker of the day, Ms. Nilanjana Maulik. With a degree in Sociology, Human Services, and Dementia Studies, and a national awardee, Best Dementia Care Worker, Nilanjana Maulik is presently the National Coordinator, Working Group ARDSI and Secretary General of ARDSI, Calcutta Chapter. She is an international master practitioner of Spark of Life philosophy from Dementia Care International, Australia, and a master trainer of dementia care skills from Alzheimer's Disease International, London. Nilanjana ma'am has been working with people with dementia and their families for over 2 decades, first in the US and now in India. She has been successful in shaping programs like community awareness, home care, career support groups, dementia training, daycare center, rural dementia clinic, and publications on dementia care. Friends, let me also inform you that we will be having a question and answer round in the end, so you can put up all your queries in the chat box. Also, a feedback form will be shared in the end, so please spare a few minutes to fill it. Certificates will be provided only to those who fill the feedback form. Now, without any further ado, let me invite Ms. Nilanjana Maulik ma'am to address the gathering. Over to you, ma'am.
Thank you so much. May I request you, am I the co-host here so that I can share my screen?
Ma'am, screen sharing is allowed for everyone. You can share this.
So I can, but when I click it on it, it says this will let you take over from Miranda House, Synapse as the main presenter. Share now, okay. Yeah, got it. Okay, you can see that, right?
Yes, ma'am, it's visible.
Okay, good. So thank you for this invitation. Thank you for this opportunity to come and share the information that we have about dementia, about Alzheimer's disease. Before I begin, just let me clear that I am not a medical person. I have been associated with this cause as a caregiver right from the beginning. So my training, my understanding of the condition and the disease Alzheimer's have been through the eyes of a caregiver. And that's what I understand, best. September is World Alzheimer's Month. Many of you are aware of it. And 21st September was World Alzheimer's Day. And throughout the world, organizations like ours, we try and raise awareness about the condition that is dementia and the disease that is Alzheimer's. Because many of you know that there is very little awareness level in India, not only in India, almost all over the world. So this is a great opportunity for us to come and address gatherings from various walks of life and let them know about what it is to experience dementia and Alzheimer's. So before I begin about the condition and the disease, giving you a global figure of dementia. So at this point of time, we have about 55 million people living with dementia all around the world. And what I've done here is listed 10 countries. And as you can see, India is highlighted. It stands third in that list with 5.3 million people living with dementia currently. And this 5.3 million, which is about 50 lakhs, will see a rise to 16.3 million, which is about 3 times from what it is now by 2050. And the reason is, of course, our elderly population is increasing day by day. And dementia as a condition is seen more among the elderly people. And there are, as I speak to you and share with you the information, you will realize that there are various types of dementias. And some of the types are causes of lifestyle diseases. And since India is a capital of many of, heart diseases, a diabetic capital of the world, these are the reasons why we are seeing a lot of people developing dementia currently and in coming years. And hence, the World Health Organization has rightly set an alarm for us and some of the developing countries in the world to come up with a strategy as to how we will tackle dementia in the coming years. To present some more statistics, some more numbers to you, it is said that every 3 seconds, someone somewhere in the world is developing dementia. And unfortunately, 2 out of 3 people globally believe that there is very little understanding of dementia in their countries. And the 55 million people currently, in the whole world that I shared with you in my earlier slide, that number is going to go to 131.5 million by 2050. And out of this 131.5 million people, 68% of that will be in low and middle income countries like ours. So it is no longer a problem of the West, no longer a problem of the rich countries. It is going to be very much our problem, and how we are going to come up with the infrastructure, the resources that we need around us to provide the best of care to these people will be the key. Some more facts to share with you. Dementia currently is the 7th leading cause of death. And 62% of healthcare practitioners, like doctors, nurses, they incorrectly believe that dementia is a normal part of aging. So basically what they feel is that as you age, it is very likely that you will forget and that you will develop dementia. But that is not true. And since the practitioners, the healthcare practitioners, are not aware of this condition clearly, they misguide family members a lot. And therefore, if you go with someone who is experiencing any issues with their brain, the doctor will probably say, not to worry, this is part of normal, aging. So, just keep the person happy. But believe me, this is a disease process and it needs to be taken seriously. Now, dementia as a condition is more common in people over the age of 65. But that does not mean that younger people do not get it. There's the early onset of the disease, and that can begin in people in their late 30s, 40s, and 50s. Very recently, we have been seeing more people in their late 40s and 50s coming to us for counseling and training and all the services that we provide. The other important information that you need to have is that dementia actually does not have any boundaries. So it can hit anyone across the society. Whether you're rich or poor, whether you are educated or uneducated, whether you live in urban area or rural area, there is no fixed boundary. It can, happen to anyone. And the most important fact that one needs to understand is that this is not a mental illness. This is a brain disorder. There's a pathological change, physical change in the brain, and hence the person shows signs of dementia. And many a times, because the person has behavioral issues, it is associated with mental illness. But clearly, we need to, have an understanding that this dementia is not a mental illness. As an organization working for, we started the Kolkata chapter of ARTSI in 1999, and India as a whole, we have been working since 1992. There are various challenges that we face as an organization when we go out and provide community care and special one-to-one services. The first one is that overall in India, we have and that includes us, everybody here too, is that we have very low brain health seeking behavior. So basically what I mean is that if we have anything to do with our brain, any issue that arises in terms of our thinking, reasoning, judgment, we do not give much thought to it. We do not run to the doctor for help. We do not discuss it with our family members or our colleagues or our friends. So basically, the awareness around brain health is very low in our country. And that's not only in our country. Many countries share the same challenge. Unfortunately, if we have problem, any other parts of the body, we do not think twice to go to the doctor. But this brain of ours that helps us to function every moment of our day is something that we really don't give much importance to. Now, that is a huge challenge for us as an organization because of this low awareness, people don't run to the doctor, get diagnosed, and then come to us for the rest of the care pathway that we help them with. The other problem we have is because India is a diverse country, in terms of the language we speak, in terms of the culture we have, in terms of the rituals and day-to-day life issue, the customs that we maintain is very different. So what we do in Bengal would be very different in Punjab or any other states. Because of this, we have been unable to come up with a detection scale. So you need a scale to detect dementia in a person. Now that detection scale is very low in quality because we are still struggling with all this diverse issue. So what if I come up with a scale in Bengal, it may not be appropriate to someone who lives in Punjab or for that matter in Kashmir. So that is the reason we have trouble detecting dementia in the community in a larger scale. And the diagnostic facilities are also very poor in India. And the reason is that there's a lack of national policy. India is yet to come up with a national policy that will give dementia, priority. And now there are some programs and services that have come up that the government of India is helping organizations like ours to promote, but that's nothing compared to the population that we have, that we have to tackle with. So we as an organization have presented a dementia national plan, a strategy to the government. Unfortunately, due to COVID, everything got delayed. We are hoping that the health ministry will come up with a solid plan that will help us to build on the resources. But until then, because of the lack of national policy, we do not have enough resources to build services and programs and activities that are needed to support people with dementia and their family members. And there's also lack of training. So as I speak to you, you will realize that to care for someone who lives with dementia, you have to be trained, you have to be counseled, because it is not looking after someone who can still reason and remember and judge. Because of their brain damage, they cannot, their higher brain function is having difficulty with. And therefore, whoever is caring for them needs to be well trained to understand their needs and, issues that they are facing. So these are some of the challenges that we, currently face. Coming to what dementia is, I think we need to be very clear that it's not a disease. It's a condition, as I said. And this term dementia, we basically use it to describe a lot of symptoms when we see in a person. And those symptoms are to do with higher brain functioning, and they have to be severe enough. Those symptoms will result in some issues of the brain, and those issues will have to be severe enough to reduce the person's ability to perform their activities, day-to-day activities. Say, for example, brushing teeth, eating, dressing, all these are our everyday activities. Or maybe, taking a bus, going somewhere, meeting someone, sharing information. These are our, we do this as we live our lives. Now, that person showing signs of dementia will be having problems with this, performing these everyday activities. And mind you, it is a bit different from maybe the way we forget things and we have difficulty with. Basically, what you will see is that this person will be having issues with not just one area. So it's not just memory loss. It will be many other areas of the brain that will be affected. So as I go to the next slide, I will be explaining those. So basically, from this slide, I want to convey that dementia is not a disease. It's just is a condition or a host of symptoms. Say, for example, when you have fever, fever is not a disease. Fever is just a symptom that you have some infection, some disease in your body that is causing the fever. So similarly, loss of memory, misplacing things, repeating things again and again. These are signs and symptoms. These are not diseases. But there are certainly some diseases that are occurring in the brain that is causing these dementia signs. So this is something that we need to be very clear about. Now, since I mentioned that memory loss is one of the most, common sign of dementia, let me kind of give you an idea as to how can we differentiate between normal forgetfulness, because all of us forget things and places and people and information. But how is it different from somebody who has dementia? This is very important to give you a clear understanding. So basically, all of you attending the webinar here today, after it's over, if somebody in the family or your friend asks you, so what did what was it all about? You spent 1.5 hours. What did you, what were you doing? Now, you may forget part of the experience. You may not remember everything I said, but you will never forget that you were part of this webinar, you attended it, and you listened to someone named Nilanjana Maulik. You may forget my name also, but you will remember parts of the experience. But a person with dementia will forget the entire experience. So basically, they will not remember that they attended a webinar in the evening. The other example I can give you is, all of us will probably agree that we are misplacing things, right? Keys and our glasses, keeping things here and there. Now, if we retrace steps and we kind of think quietly, okay, let me think, where did I last put it? Maybe look, and you have the ability to retrace your steps, go back and find those keys. But a person with dementia will be absolutely unable to retrace steps. They will not remember anything before that moment. And the other severe thing is that in our case, once we have the keys in our hand, we will know exactly what to do with the keys. We know that these are keys and I have to go and open my cupboard. That's why I was looking for it. But a person with dementia will not recognize the keys and the function of the keys are. So your forgetfulness and your understanding of something has to be that badly affected. So it's, we jokingly say that, oh, I think I'm having dementia these days. I'm forgetting things. I think I'm having dementia. But believe me, it's not so black and white. It's really severe, and you will have to meet a person living with dementia to understand the severity of this condition. So I'm not going to go into all the examples, but I hope it is clear to you what the differentiation is. Now, here are the 10 warning signs of dementia. And these are very important for all of us to keep a note of, if not all, at least 5 or 6 of them, because when you need to, for the severity of the condition, you need to have at least 5 or 6 of these symptoms, and that's when the doctor starts to detect and go in-depth analysis. So number one common symptom is memory loss, and this memory loss is short-term memory loss. So you will basically forget what did you have for breakfast this morning, or maybe you will forget who called you 2 days before, and that was a very important call. You remember, but you cannot remember who called you. So the memory loss is there, but it is short-term. They will remember the information from the past years. So 30, 40 years back, they remember information very clearly. Difficulty performing familiar tasks. So they will have difficulty in performing their familiar tasks, like I gave you examples: brushing your teeth, eating, dressing, tying up your shoelace. These are familiar tasks. These we don't have difficulty with unless until we have some pain in our hands and body. But this problem will be from brain, and therefore they will not be able to remember the sequence of a task, that you have to put the paste in the brush and then brush your teeth. You may see them putting their brush without the paste on. So these are difficulties that you see. Problems with language. So they will have word finding difficulty and putting all those words together in a sentence and explaining it. So this is a huge issue in people with dementia. They also have problems with time and place. So there's totally disorientation of where they are and what is the time. So many of our caregivers will call us up and say, Nilanjana, my father is at home, but he continuously says, I want to go home. Or he wakes up in the middle of the night and he takes a bath and he wants to go out to the grocery, and we keep telling him it's nighttime, everything is closed, nobody's awake, but he just refuses to accept it. So they're totally confused about time and place. They also have difficulty in judgment. So crossing the street, or whether it's hot or cold, that kind of judgment is a problem. They also have problems keeping track of things, when, where, how, what. They misplace things. When you hear this, you may think, oh, that's something that I do all the time. But again, it's very different from the way people with dementia misplaces things. So you may, take off your eyeglass, put it somewhere in the desk, under the pillow, and forget about it, and then you look for it. But people with dementia will not put misplaced things in such obvious places. They will, you may find their eyeglasses inside the refrigerator, because to them, it looks like a cupboard, so they'll just open and put it in, not realizing that that's a place that's in the kitchen and it's for food and it's to keep it cold. No, none of those, reasoning is working. They have changes in mood and behavior. It's the same with us. We also have changes in mood and behavior, but again, people with dementia will have very frequent changes in mood and behavior, and sometimes without obvious reasons. They also have trouble with images and spatial relationship. So, if I show them this image, they will have difficulty in understanding that there's a sequence to the numbers. There are people and information in each. So if you show them an image, they cannot make sense out of it. They also have problem with spatial relationship. So they will have difficulty understanding how far are you from him or her. So a lot of times people with dementia will come very close to you and start, speaking and, moving their hands, and, you may get hurt, or, you may get bumped. So because their spatial relationship is compromised. They also start withdrawing from their usual work routine and also social activities. So these are some of the warning signs, and that's, it starts very slowly and quietly. That is why it's missed in the early stages, and never detected. And that's one of the reasons why we as an organization, we are trying to detect dementia early in the community. Now, these are some of the causes why the dementia signs and symptoms take place. And these are basically the diseases why the dementia signs and symptoms we see. So there are reversible causes and then there are irreversible causes. So under the reversible causes, you have brain injury. So if you bump your head, you met with an accident, you may have blood clots inside the brain, and then you may start showing signs of dementia. You go to the doctor will treat your blood clot, and slowly your dementia signs and symptoms will start to go away, fade away. Same with thyroid problem. If you have an underactive thyroid gland, it's untreated, you may start showing signs. If you have vitamin B12 deficiency in your body, you may start showing signs. But these are all treatable conditions. These reasons, these diseases can be treated, and the signs of dementia will fade away. But we as an organization, we tackle the irreversible types of dementia. So these are the diseases that once it starts in the brain, it's very difficult to reverse them. And one of the most common form is Alzheimer's disease. So Alzheimer's disease, basically a classical sign and symptom of Alzheimer's disease is forgetfulness. So they start forgetting things, names, places, anything, and everything. And the second one is vascular dementia. It's another type of dementia. Here, basically, the blood supply to the brain is interrupted, and therefore you have minute strokes in the brain. And because of those minute strokes in the brain, the parts of the brain that are affected with those strokes will have difficulty. And in vascular dementia, the classical sign and symptom is not forgetfulness. It's repetitiveness. So the person will repeat things, repeat activities. They also will show signs of changes in their personality. Dementia with Lewy body is another type of dementia. And this Lewy body causes dementia signs and symptoms. And here again, forgetfulness is not the main symptom. So basically, the person starts to hallucinate. So basically, when I say hallucination, I mean they will see things and hear things that are not true. They will also have delusion, which is having false beliefs. They will also have frequent falls. So they will keep falling. Their mobility is affected to a greater extent. The other type of dementia is frontotemporal dementia. This is one of the most difficult dementia to deal with by the caregivers because it basically affects the frontal part of the brain, the frontal lobe, temporal lobe. And the function of this frontal temporal lobe is basically, it drives your behavior. So what is appropriate, what is inappropriate. And it helps you to function as a human being. But when that part is damaged, your understanding of what is appropriate and what is inappropriate goes away, and you will do whatever you feel like. So we have families calling us and saying, "My father just came out of the toilet without wearing any clothes, or he's urinating in the kitchen." I mean, why is he doing these things? It's because that inappropriate and appropriate behavior is damaged. So this is again a very difficult dementia to deal with by caregivers. There are other types of dementia that I'm not going to go into today. Now here's a picture of the brain. On the left hand side is a normal brain, hoping all of us have that. And on the right hand side is a brain that is affected with Alzheimer's disease. You can clearly see the change in the size of the brain. It's because all those 100 billion nerve cells, neurons, have started to die. Basically, what the research has shown that there are a lot of deposition of proteins, the amyloid protein, and because of the unknown cause of this deposition that we are unable to yet find the reason why this deposition takes place. Now, because of this deposition, the nerve cell starts to die, and until today we are yet looking for a complete way out as to how we can keep or live these neurons in the brain. Now, as I said, brain is one of the most neglected parts of our body. We don't care for it much. We do not think much, but it is, we are because of the brain. Um, we are who we are because of the brain. But unfortunately, we do not give much importance to it. But in coming years, we are going to see a huge number. And believe me, if I were to ask, all of you here present, how many of you think would develop dementia in coming years? Because by 2050, the number is going to be huge. And it's the young population who are in their 20s and 30s are the ones who will be seeing a huge jump in the number. And now, many of you may say, no, 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 I'm not going to have it. That's great news. If you don't have it, that's fine. That's great news. But you may not be relieved altogether, because you probably will have to look after someone who has this condition. And either way, you have to be aware of what dementia is and what it does to the brain. So coming to diagnosis, how do the doctors detect dementia? It's a very difficult process. It doesn't happen over one doctor visit or maybe in half an hour or 5 minutes. It's a long process and it takes time, and therefore a lot of misdiagnosis happens, and not done correctly. So if you go to the doctor with all the 10 warning signs that I have discussed with you, that you go and tell him that these are the signs and symptoms I'm having, the doctor will first of all rule out the reversible conditions, the vitamin B12 deficiency or the thyroid gland problem, any physical change that you may have in the brain function. Once the doctor rules out those physical issues, then if the doctor still sees that no, those are not the problems, they will go for cognitive and neuropsychological tests, which will basically evaluate your reasoning power, your judgment power, your attention skills. And they will also go for neurological evaluation. They will also check your senses, your balance, your reflexes. They sometimes order scans of the brain, CT, MRI, PET scans, because in the PET scan you can see the amyloid protein in the brain, and which is a hallmark of Alzheimer's disease. And if there are any behavior issues, the doctor will also do psychiatric evaluation. So there are scales that are used to do the neuropsychological examinations. Now, here I have listed the 3 stages of dementia, the irreversible types of dementias, the Alzheimer's disease or the vascular dementia, those. So in the early stages, the person basically is functioning independently, but it's only in the multitasking that the person is having issues with. In the middle stages, the person is slowly starting to depend on the caregiver for their daily activities, because then their brain is starting to give them challenges. So they are unable to remember the sequence of a job. They are unable to remember the facts. So they are starting to depend on someone. They also show behavior changes in this stage. And the last stage, which is the severe stage, the brain is mostly damaged and they are significantly dependent on the caregiver. At this stage, they are also unable to recognize their loved ones. They sometimes may not also recognize themselves. And they also have difficulty to communicate, because the speech, which is, helped by the brain, that's damaged. That part is damaged, and therefore they will have problems in communicating. And basically, overall physical and mental, decline we see in a person. Now, so caregivers who care for these people with dementia has a huge impact on their lives, because, they have to basically look after someone who is unable to function anymore. I mean, when you look after a child, you have an expectation that this child is going to learn and be independent in coming years. But here you are looking after someone who was independent all these years, but suddenly depending on you for everything, and things that you never thought he would depend on you, like brushing, helping him with brushing. I mean, he's forgetting how to brush or forgetting how to eat. So you give a plate of food and he will look at it and not know what to do with it, because he's not recognizing, the reasoning is not working. So it's a huge toll, the stress and emotional toll on the caregiver is huge. Over and above that, they also have to, manage their other household duties, outside job. They also have to keep talking to the doctor and nurse to make sure that everything is in sync. And after all this, they are also expected that they should be patient, and they should be motivated, and they should be positive, because they are looking after someone who has dementia. I think this is a huge expectation from a person, trying to juggle so many roles. 80 to 90% of these caregivers are mostly women. They are either spouse or a daughter, or daughter-in-law, or a paid help who's a woman. And most of them have reported that their mental and physical health is extremely poor because of the caregiving responsibilities over the years. And many of them have said that they've given up on their hobbies, on their independence, and vacation, and how they should, what they had planned earlier on, how they would live their lives. So basically, they have to change their view of life and adapt to a different lifestyle, because here you are dealing with somebody. Recently we had this gentleman who was a professor of statistics from Berkeley University, and he was associated with World Health Organization, and an extremely intelligent person, with dementia setting in his moderate stage. He was unable to even count 2 plus 2, and his wife absolutely refused to accept this fact. So this is a huge change in the way they think. If we come to, sorry, did I miss something? Yeah, that's fine. So if I come to the treatment part of this disease, the irreversible types have no cure at this point of time. There are ways to manage the symptoms, and they are through medication. Very few medication, 2 or 3 medications used anywhere in the world, just to temporarily improve the signs. But the progression is going to happen. It's an irreversible condition. So once it starts in the brain, it is downhill. So 10% is medical intervention, and 90% is psychosocial intervention. So where you basically, in simple language, I can say that psychosocial intervention means music, storytelling, reminiscence, validation therapy. So there are various therapies that we use to keep the person's quality of life intact. This is a very important slide for all of us here, to understand the risk factors. So age is one of the most, the greatest risk factor. We are going to age every year, and that's not in our hands. It is said that as you age, your chances of developing dementia increases. Family genetics. So if you have someone in the family, your chances increases, but this is very rare. It's only for people who have early onset. So in their 40s and 50s, those who develop dementia may show, their children may show these, but once in their late stages, that's very rare. Between the age of 65 to 75, more men we see. After the age of 75, it's more women. People who are highly educated, it's a protective factor. Those who have hearing impairment, that's a risk factor, because what has been seen through research is that the brain damage, the brain atrophy is greater in people who have hearing impairment, faster atrophy. Physical inactivity, I cannot emphasize more on this. If you are physically inactive, you are highly likely to develop dementia. Lifestyle diseases, so you're diabetic, if you're hypertensive, if you're obese, you also develop chances. Infrequent social contact. So if you are not in touch with people, you're not talking to people. And when I say social contact, I do not mean through Facebook and WhatsApp messaging. I mean talking to people. So if you are not doing that, then you're in big trouble. Smoking, alcohol, these are risk factors. Head injury. If your diet is not, is lacking in nutrition. If you are having medications for a chronic disease for a much longer time, especially, sleep medication or pain management medication, this causes dementia. If you are not stimulating your brain enough, then that could be a cause of dementia. If you're not sleeping well, 6 to 8 hours of sleep recommended by the World Health Organization. If you're not sleeping well, if it's disrupted, if you're waking up a lot, then your chances increases over a period of time. It's not a day or two. And when I say this, I mean for a long period of time if your sleep is disrupted. Air pollution has been recently added. It's bad for the lungs, it's bad for the heart, it's bad for the brain. So, the more we, manage these risk factors, the less our chances of developing it. So coming to prevention, what can we do to prevent? Because as I shared that it's going to be a huge issue in coming years. So how can we prevent dementia? And the focus is very much on that. So regular exercise, physical exercise, 150 minutes of exercise per week. That's been a recommendation from World Health Organization. Also, it has been recommended through research work that you should not sit in one place for more than 20 minutes because that's not good for your health, not for your brain. So if you are sitting in one place for 20 minutes, you basically have to stand up, maybe go out for a cup of tea or a glass of water, walk for 10-15 minutes, come back and sit again. It's very much the need of the hour because we spend a lot of time sitting down these days. Social engagement, I've already mentioned that you need to engage with people, you need to interact with people, join clubs, volunteer somewhere. I understand with COVID it has become very difficult to be physically present, but over a phone call, a telephone is what we need to do. Healthy diet, so you need to eat well, good for your heart, good for your brain. So whatever you will eat to keep your heart healthy, it's the same for the brain. So green leafy vegetables, Mediterranean diet is recommended because it has been seen that people in that region, less likely developing dementia. And it is said that the diet is very rich in green vegetables, fruits, nuts, whole grains, fish, which has omega fatty oil, red wine to moderation, green tea, which has antioxidants. So these are some of the recommended diet. Haldi, which is one thing that we use in our food, is actually a very good protective factor for keeping our brain healthy. And if you can have raw haldi, it's very good. Mental stimulation. So when I say mental stimulation, I basically don't mean doing same thing over and over again. You basically have to learn something new every day. So you should have an agenda where at the end of the day, when you go to bed, you have learned one thing new. And it could be through what you are doing every day. Say, for example, somebody cooking, does cooking, that's their person's main work. That person should continue to cook, yes, but also need to try out different recipes, because only in trying the new things will she be able to stimulate. There's a phrase called use it or lose it, and that's for the brain. If you're not using your brain enough, then you would lose the nerve cells, irrespective of whether you have dementia or not. So stimulating your brain is one of the recommended preventive strategies. So as an organization, this is the way we manage dementia as a condition in the community. First of all, it is through these awareness talks that we raise awareness and we try and prevent dementia in the community. So we'll make people aware of the risk factors and the preventive factors, and we want you to prevent dementia. If somebody develops sign, we make sure that diagnosis is done well. Once the diagnosis is done, we make sure that the family and the person living with the dementia is supported and living well. And it is possible to live well with dementia, unlike the assumed notion that it's a death sentence. So if somebody has dementia, it's the end of the world. It's not. I mean, I have been working for people with dementia for the past 27, 28 years now, and I wake up every day and I have the same energy and same enthusiasm when I go and meet them, even though they forget things, don't remember me. But every day is a challenge, and every day the whole intention is that to enjoy life, you don't really need memory. I mean, you live in the moment and you can enjoy. So that's our strategy. And the last one is very, very important, because as medical science is, improving, we are living longer, and if we live longer, we even if we don't want to, we will be made sure that we continue to live. But our quality of life may not be that good. I mean, we may have masks, the ventilator on, the Lyle's tube on, all kinds of support systems to keep us going. But that's not how probably we would want to live. Many of us, I mean, if you ask me, I don't want to die, with all the tubes and staying in a place that is unknown to me. So dying well is a concept that is new, and we are trying to, kind of advocate this concept where we tell the family that it is important that you make sure what the person would want to at the end stage. And the best is if you can do it now. So people who we consider have a normal brain should start thinking how they would like to die and put it down in a document and share it with your family members. You can legalize that. You can sign it. A lawyer can sign, and that could be used as a checklist for the medical professionals to go through when you will be in a stage when you will not be able to speak for yourself. So this is something that we are trying and advocating. This is a very new concept, but we are trying. So since the quality of life of a person living with dementia is not that great because the environment around them is very threatening. People whose brain are still functioning, we actually do not have many skills. We do not have a skill which is most needed is to adapt ourselves to someone which is not something similar to us. So we are very uncomfortable sitting in with someone who's not able to answer our questions properly, who is unable to understand what we are trying to say. So we are very uncomfortable with that kind of situation. And therefore, there are certain barriers in improving quality of life of a person with dementia. So the biggest barrier is stigma, that it is a mental illness, that it's the end of the world. That assumption itself causes a huge threatening environment. The other thing is the medical culture versus the holistic care. So every sign and symptom or every issues the person with dementia has is seen under a medical microscope. I may feel sad one day and not want to eat, or I may not want to do something. That's not necessarily because I have dementia. It's just that even without dementia, I may feel that way. But a person with dementia is always seen under a medical microscope. And that makes it very difficult for us as organizations because we see the person first and then the disease. This is a huge barrier. So what we do is basically as an organization, we develop skills, dementia care skills in young people or professionals who want to take it up, or family members who want to really provide the best of care. So these are some of the listed skills that we try and develop through training programs. Knowledge of what dementia is, you have to have the knowledge. Communication skills, effective communication skills. So we all know that it's verbally what we say makes lesser impact than our non-verbal expression. So our body language, how we are looking at a person, how we are using our tone and pitch of voice, these are more important than the verbal words. So that is what we teach because in a dementia person, the communication is affected. So the more you can be good at non-verbal communication, the better for the person to understand you as a caregiver. Empathy. So it's you have to be empathetic of the person's condition, not sympathetic. You have to be creative. If you are not creative, say for example, if somebody is hallucinating, and just the other day it was raining heavily, and this lady, she comes out at the balcony of our daycare center, and she looks out and she's hallucinating that there are children out there playing, getting drenched. Get them home, they're going to fall sick. Now, as a caregiver, you have to be creative. So you know that the person is hallucinating, and if you tell the person that whatever you're seeing is wrong, that's not correct, there's nobody playing out there, then you will not be able to provide good care to that person. So your positive response to that difficult behavior would be absolutely, this is what children do all the time. When it rains, that's the children, that's the usual thing. I mean, you and me did the same thing when we were young. But don't you worry, I'm going to make sure that these kids go back home. Why don't you come with me and let's have a cup of tea in this rainy weather? So what I basically did is, I know she's hallucinating. I'm not going to, tell her that you are hallucinating and whatever you're seeing is wrong. I'm basically going to validate her feelings. So in her reality, she's seeing that. So I'm going to validate that first and then take her out of that situation. So for that, you need to be creative as a person. You need to come up with solutions. Listening skills. So you'll have to listen with your heart, not with your ears. That is something very much needed. Sense of humor. You have to have sense of humor, because you will have people coming and telling you things that, will absolutely be, kind of breaking your head. You feel like breaking your head. But if you have sense of humor, you can take it in a very different way. Curiosity. So you need to have a lot of curiosity, like a detective. Self-confidence, and one of the most common things missing from, because I train a lot of people, I see common sense missing from a lot of people. So basically, when I say common sense, I mean standing on your feet and taking a decision, which is probably going to work. So these can happen over many weeks, rehearsals, role plays. That's how we do it. So let me end by giving you a little introduction of our organization. It's the Alzheimer's and Related Disorders Society of India, Calcutta Chapter. We started in 1999. We are one of the 24 chapters in India. And, besides raising awareness and caring for people with dementia and their family members, we also have a lot of publications. We have a daycare center. We have home companionship program. We do a lot of research around this condition. We have caregiver support programs. We have rural outreach programs. And in the long run, we would like to, and training program, of course. And then in the long run, we would like to start a 24/7 care. So as I end, I really would like your support, in the sense that as students, as future caregivers, you need to understand dementia. You need to feel dementia. We don't basically, as caregivers, we don't see it as a biological change in a person. We see it as a human experience, and that's what keeps us going as a caregiver. So with your understanding today, you will be able to go and talk to another 10, 15 people, and that's how you will help us rethink the way people think about dementia. You can volunteer your time in your, where you live. There are local associations there. And a new concept that is coming up is dementia-friendly place. So basically, you can start with your department, zoology department in your University of Delhi, where you can make everybody dementia-friendly. So you can raise awareness about dementia. So they themselves can go and raise, more dementia-friendly place. So hospitals, railway stations, airports, malls, grocery, pharmacies. These are places that we recommend that you go and make them dementia friendly, because anytime a person with dementia can walk into these places, and they may face difficulties. But if the employees, there in that, say for example in the bank, if the employees are aware of what the issues are with dementia, they will know exactly how to deal. And the whole intention is that we will keep people with dementia live in the community as long as possible. Because if you kind of start behaving differently with them, then they will be socially isolated, and that will cause even worse, quality of life for them. So that's all. That's all from me today. Thank you so much. Did I stop my presentation? Yeah. Okay. Can you hear me?
Yes, ma'am.
Okay, good. So that's all I had to say today. I hope you'll have some questions for me, because as we say in dementia care, there's no right or wrong answer. Anything you ask is the right answer. So if you have any questions, please feel free to question. No questions? Okay, there are some questions in the chat box. What is the difference between dementia and Alzheimer's disease, right? So yeah, dementia is the symptom and Alzheimer's disease is the cause of those symptoms. So Alzheimer's is the disease, and because of that disease in the brain, you are seeing these dementia signs and symptoms. So say, for example, if you have fever is just a sign that there's infection in the body. And so that infection is dementia and dementia is the fever. So if I have been able to clear that out.
Ma'am, there are some more questions which have been sent to me, so I'll just convey them. So
Sure.
the first one was that what can people in their 20s do to reduce their chances of getting dementia or Alzheimer's in the future?
So, all the risk factors that I mentioned, you need to, those are that are in your hand. So basically physical exercise, mental stimulation, and, eating right. These are things you have to do. You also, because of your, the new generation is very much into, what should I say, gadgets. You have to, of course, you need to be, spending time with your gadgets, but you also have to make sure that you're connecting with people, you're talking to people, you are interacting. Basic, eat well, exercise well, interact socially, and stimulate yourself. So just studying your studies is not only stimulation. You also have to learn new things all the time. So besides your, studies, also try and learn new things, things that give you joy. It's music, it could be music, art. Yeah.
Yes, ma'am, there's another question that in rural areas where the awareness regarding mental health or dementia is very low, how can we diagnose the signs of dementia and how can we have some intervention in those areas? So what is the strategy for rural areas?
Right. So basically, when we started this organization almost 5-6 years, we did not do anything in the rural areas, but we would see people from the rural areas come to the urban clinics because their family members were, especially because of the behavioral issues, they could not tackle at home, so they had to come to the doctor. So, our organization, we started this rural clinic in 2015. And so basically, we do two things. What we do is we raise awareness not through leaflets, not through talks like what I did today, but more through acting out, the issues. And we do a lot of counseling, one-to-one counseling with the family members. And the kind of publications that we have for rural areas is more visual picture, and especially the things that they are used to. Even for the detection scale, say for example, the detection scale in the urban areas would ask you to do a clock drawing. Okay, so one of the question in the detection scale is the psychologist would ask you to draw a clock and then put all the numbers and then put the time of the clock then. But if you go to the rural areas, especially interiors, they are not used to clock, right? So our detection scale had to be adjusted accordingly. So if you give them a clock drawing, they will obviously fail, and then you would mark them as having dementia. But that's not true, because what we have seen in many cases, that when you give them something like drawing a rangoli, they could do it. That means their orientation, their visual spatial is absolutely still okay. So I think it has to be that appropriate, So when you go and detect dementia in rural areas, it has to be appropriate to that culture, to that region to the language, everything has to be taken care of.
There's one question that, ma'am, what steps can we take to make people dementia friendly in public places like restaurants, park, etc.?
This is a lovely question. In fact, this reminds me of a restaurant in Japan, in Tokyo. What they did was, we haven't tried yet, but what we have, I'll tell you what we did this year in Kolkata. But in Tokyo, this restaurant, which is named I'm forgetting the name, sorry. So this restaurant basically is run by people with dementia, okay, in the very early stage. So you go and you sit and you order things, and you tell the person with dementia that this is what I'm going to order. And depending on the person's ability to remember, that person will go and convey that. So you have to be prepared. What comes at the end may be very different than what you ordered. So this is a way of making people aware of dementia and making people accept people with dementia. So this is a restaurant in Tokyo that has done that. And I think what we did this time in Kolkata is we actually took up one eatery that serves that has about 24 outlets in Kolkata, in West Bengal area. So what we did was we kind of changed the recipes, all the lost recipes of Bengal, and we put the recipes there. Each recipe had a one-liner where it reminded the person with dementia of the recipes of their grandmas and the old recipes. So we invited people with dementia, and many were able to choose that I want to eat this, because they could immediately relate to that recipe, because the name kind of triggered their memory. So I think we can do a lot about raising awareness in the public restaurants. The waiters and the restaurants could be employees could be given an introduction. You can go and talk about dementia and make them aware. So a lot can be done. You can be creative.
Absolutely. Creativity is the best tool to tackle these kind of situations.
True.
There are a few more questions, ma'am, that can dementia be diagnosed in young people?
So when you say young people, basically, if the dementia, if it depends on what type of dementia it's, whether it's reversible or irreversible. Now, if it is reversible, then if that young person has thyroid issues or vitamin B12 deficiency and is showing signs of dementia, then the doctor will go accordingly. But as I said, early onset dementia in the 30s and 40s and 50s are very rare, but it does happen. And they will also, it's the same kind of detection method, that the diagnosis method that the doctor will have. But very rare in young people, very rare in young people.
Also, there's a question that, ma'am, dementia is seen maximally in senior citizens. So, do we have organizations collaborating with Vidyashrams or any other organizations that work with senior citizens, or are we lacking in that phase?
So the old homes, like in Kolkata, we have visited most homes, and we have, we do screening camps there to find out if they have, not necessarily all people living in a Vidashram will have dementia. There are many 80, 90, 70-year-olds that are absolutely sharp. This is a disease. It can happen to anyone. So we do a screening, and we kind of collaborate with these organizations. I'm not sure how much is done all over India, but yes, many organizations like ours, they are collaborating with old age organizations and doing such programs. So we are trying our level best.
There is a question that, is there no possibility to treat or improve the irreversible dementia?
At this point of time, no. There is no cure. And the treatment, as I said, there are a few medications that can help improve some of the symptoms. but the progression is going to continue to happen. So, the medications that are used will probably keep you going for 6 months, but that's it. I mean, the progression will probably continue to happen. And it is even said that today, if you are detected with dementia, a reversible type, it's not that the brain damage has started from today. It has started maybe 5-6 years or maybe 10 years earlier in the brain. But because of your brain reserve, you were continuing to function. But as kind of declining the brain functions, you are starting to show the signs and symptoms. So that's how it is.
There's one more question, that is dementia starting to become more common, especially due to the pandemic? Like, is there any correlation between the pandemic and dementia or Alzheimer's?
So there's a lot of studies that have started on this area, dementia and COVID-19. Many people died, dementia people died, lost their lives because of COVID, because they were not following the protocols, right? Because they were not remembering to wear their masks, sanitize their hands. It was very, very difficult, and because they depend on somebody to be taken care of, so a caregiver had to be with them to take care, right? I mean, they were unable to do them by themselves. So there's a lot of research going on, started between to see the relation between COVID-19 and dementia. And yes, we have found to some extent that the COVID was definitely COVID will in the long run definitely bring more dementia population in the coming years. Maybe because of damage to the brain functioning. So it's in a very early stage. We cannot say for sure, but we are world over, they're looking into this aspect, definitely.
Thank you so much, ma'am, for answering our questions. I think we don't have any more questions as of now. If we have, then we'll surely maybe ask the question to get back to you if it's an urgent query. But thank you so much, ma'am, for patiently answering all our queries. And it was
Thank you,
really
Damayanti.
important for us to know this, because I think as zoology students, many times we get detached from the social implications of what we're studying. So the session was really, really informative for us in that aspect.
Thank you. Thank you. Thank you so much. Thank you so much for coordinating the whole thing and making this possible. I'm really, really grateful to you and the rest of all the participants and the faculty and your department for this opportunity. So yes, anytime you have any questions, just email me. Thank you so much. Thank you. And I hope many of you will join the movement in coming years and make a difference. Thank you so much. Thank you.
Thank you so much, ma'am, for answering our queries.
Thank you.
May I now request Dr. Sadhna Sharma, ma'am, to say a few words.
Thank you, Nilanjana, for such a beautiful lecture to appraise students about such a problem that exists, and they are the best solution to this problem because they can provide the care and support. Being the future caregiver, they should be trained, and that's what people like you are doing. I'm really impressed with your work.
Thank you.
And the solutions are very simple, the way you have depicted in one of your slide, that if a boy has a habit of putting his thumb in his mouth, you can do an alternative thing to take it away from there. That was very interesting.
Thank
of course,
you.
Like the newer generation need to have listening skill. Rather, they are more towards use of phones and other things, even if they are living in a family. So 4 people sitting in a room all of them using phones is not the right thing, and they should also be informed about this. And of course, they can take care of their parents and grandparents. That's the best thing
Absolutely.
they can do. So if they volunteer their time, then it's really very good for all of us. Thank you. Thanks a lot for everything you you are doing and you did for our students. Thanks a lot.
Thank you. Thank you. Thank you so much.
Thank you so much, ma'am. Now I would like to call upon Kritika to propose a vote of thanks on behalf of the Zoology Department.
So good evening, everyone. I, Kritika, on behalf of SYNAPSE Zoology Society of Miranda House and IQAC, would like to thank Ms. Nilanjana Maulik for taking out time from a busy schedule and broadening our knowledge about a very important condition such as dementia. Thank you so much, ma'am.
Thank you.
I would also like to thank all the teachers and the Synapse Council members who really worked hard to ensure the smooth running of this event. Also, a big thank you to all the students present here for paying attention and cooperating with us to make this event a success. Thank you so much, everyone.
Thank you. Thank you.
Once again, ma'am, thanks a lot for this session.
Thank you. Thank you. You all have a good night and take care, all of you. Thank you so much.
Yes, ma'am.